answer questions. Sorry, just gotta, we can then answer questions. We can answer your questions so you don't forget them between now and the end. So let's get to mental health. So what is mental health? I'm not the kind of instructor that reads slides to you except the questions. So everyone, every single one of us has mental health issues, positive mental health issues, negative mental health issues, neutral mental health issues, but we all have them. So what is mental health? It includes the emotional, physical, psychological, and social well-being of all of us. How we handle stress is what determines whether or not we make healthy choices for our mental health. It is a lifelong process for all of us, and we have to have successful adjustment to the various environments that we're in. Now, as nurses, both internal and external environments, we have to learn to be able to control it. As a nurse, I worked in urology and pediatrics for many, many years before I was teaching. And I had, in terms of my own mental health, I had a tremendous amount of difficulty dealing with children who had been abused, particularly sexually abused, but abused in general. And we saw a fair number of them in urology. So I had to learn to block that out, lock it in a little compartment in my brain, because I needed to not only address what was going on with the child, but I also needed to address the perpetrator on many occasions. So that's just one example of how, as a nurse, I had to figure out myself how I was going to deal with this and then go home to my 4 children. So all of us have mental health issues. Next slide, Devin. The influences, there are various influences that some I've kind of already touched on my experience. You know, what are your health practices? What are your own beliefs? What is your family influence on that? And everyone's mental health changes over time. My mental health at my age, that I won't tell you, is far different than my mental health was when I was 20 years old or even 30 years old. And I'll leave it at that because I want to think I'm always going to be 30. So it changes over time, and it changes when demands are placed on us, whether it's additional children, whether it's school, whether it's work, whatever it is, demands are placed on us as people. And we have to dig deep for our resources in order to handle those things. We may have economic hardship. We may be caring for others, as I just gave the example as nurses. How about COVID? How about, COVID fatigue and COVID mental health and long working hours that nurses have had during COVID? It's just something not to think about mental health in terms of those that have serious mental health diseases, but everyone's mental health. And in every case, whether you're taking care of a patient that has schizophrenia, a patient that is depressed, a patient that has bipolar, a patient that is elderly, a patient that is healthy, they all have mental health issues. And questions you get on NCLEX, 99% of the time in mental health are going to come down to one thing, and that is therapeutic communication. Open communication, open affect with your patients. Next slide. So in terms of therapeutic communication, the goal of the nurse-client relationship is to facilitate quality-centered care. We use, all of us, whether it's as a nurse in the hospital, whether it's as a student talking to an instructor, whether it's some of you listening to me saying, oh God, when's this going to end? The goal as a nurse is to facilitate quality client-centered care, your relationship with the client. We all use both verbal and nonverbal techniques, and we need to build trust and provide comfort. Therapeutic communication is appropriate, it's efficient, and it's flexible. We can use silence, we can use active listening, we can ask open-ended questions, and we restate what the client has said so they can rehear what it is that they might have said to you. So again, not reading the slides to you, but just really a few things on this slide. Listen with an open mind. It's hard when you have several patients, but listen with an open mind. Restate what the client may say to you. Forgive me, I use client and patient interchangeably. Reflect on things. Summarize what the patient might have said to you, but always focus on the client's feelings and present reality to them. Next slide. The flip of the coin is non-therapeutic communication techniques. Giving the client advice or expressing approval or disapproval, changing the subject, making value judgments, placing the client on hold. Well, just a minute, I have to finish this before I talk to you. Asking the client why, like, why do you feel that way? Again, focus on the client's feelings and present reality. Next slide. We have a question. Always when you look at the questions, and I'm sure that early on this morning you were told this, but always in your questions, look at those red words. Will they be read on NCLEX? No, they won't. But you can bury these words in your brain so that you'll be able to take from them. That's part of your strategy of answering questions. It's not just knowledge, it's strategy as well. So the nurse is collecting data on a client diagnosed with depression. The client says to the nurse, I haven't had an appetite at all in the last few weeks. Which response by the nurse would be appropriate? Most appropriate. The last few weeks? Can you tell me more about your change in appetite? Once the medication begins to work, you'll feel better. Or think about everything you've been through. It will take time for your appetite to improve. Okay, a couple more seconds, and we can close the poll. Can you tell me about your change in appetite? Absolutely, absolutely correct. 100% of you got it. It's an open-ended question. You're not, number one, the last few weeks, that's kind of like putting them down. You're cutting them off with number 3 and also with number 4. With number 2, you are giving them the opportunity to discuss how they feel. In terms of depressive disorders, major depressive disorder, if you're taking notes, the patient may have dysrhythmia, they may, dysthymia, and also premenstrual dysphoric disorder. There are people, that's a diagnosis that was not around when I started my menses. Depression characteristically are feelings of hopelessness, low self-esteem. And also when somebody is depressed, or you think from what they've said about like a change in appetite, giving things away, you always want to think about whether or not they may have some sort of plan, or they may be thinking of harming themselves. Next slide. The nurse is collecting data from a client with a diagnosis of depression who is being admitted to the psychiatric unit, which is the priority question that would elicit information regarding the initial plan of care. So you're looking for a question that will tell you what you should do initially in caring for the client. 1, are you sleeping at night? Do you have any thoughts of harming yourself? How did you get those cuts and bruises on your arm? Are you eating adequate amounts of food each day? In the poll. Okay, a couple of more seconds. I think we're good. Are you sleeping at night? Okay. Do you have any thoughts of harming yourself? How did you get those cuts and bruises on your arm? So are you sleeping at night is what? It's a yes or a no. What's it going to tell you? What is it? Is it a question that can elicit more conversation? How'd you get those cuts and bruises on your arm? This could be considered accusatory. But do you have any thoughts of harming yourself? You need to know that when you're taking care of somebody who is depressed, you must ask the question. Don't be embarrassed to ask the question. You must ask the question. Do you have any thoughts of harming yourself? Know the signs of increased suicide risk and know suicide precautions. A suicide can be a threat or a warning. It can be the client may be giving things away, get very depressed, as in the last slide, I haven't eaten in a week or weeks. I just can't do anything anymore. My life is not worth it. And I could go on and on with things that people say. You need to ask them directly, and that'll be an NCLEX question. Do you have any thoughts of harming yourself? Now, you could say, well, that's a yes or no question too. It is, but if they say yes, that gives you a tremendous amount of information of where to go in terms of the plan of care for this client, including things like observation of the client, monitoring, providing a protective environment for the client. You may need to search the client for some kind of a weapon that they may use. Be aware of the major signs of depression. Next slide. The nurse is caring for a client with a diagnosis of schizophrenia, observes behaviors indicative of paranoia. The nurse would include which intervention in the plan of care? Encourage the client to lead a support group. Encourage the client to socialize with others. Avoid joking or laughing in the presence of the client. Inform the client about support groups that are available in the community. Paul? Okay. Close poll. Okay. So in terms, I'm going to go with these people that answered. So 36% of you said inform the client about support groups that are available in the community. Yes, you will do that at some point in the plan of care, but the intervention that you want to do is remember, this client is paranoid. They're paranoid. So what is the client going to think if you and another nurse are standing outside of their room joking and laughing? If they're paranoid, they'll think that you're joking and laughing about them. So the answer is number 3, avoid joking or laughing in the presence of the client. Now, for those of you that are taking notes, schizophrenia and psychotic disorders are a group of mental disorders characterized by psychotic features, including key symptoms of schizophrenia, which is what this question relates to. Delusions, delusional thoughts or beliefs, hallucinations, paranoia, disorganized speech. So you need to know, in terms of answering questions, that safety is the priority for these clients or patients. Next slide. Before I go into the client with the mood disorder, I want to make one more note for those of you that are taking notes, and that is in your RN comprehensive book. I'm sure you all have the comprehensive NCLEX book for RNs. In the mental health chapter, in my notes, it's chapter 69. It may have changed, 65, but it's the mental health chapter in its box, either 13 or 14. There's a box that gives you all of the interventions for dealing and taking care of a client who is schizophrenic, including assessing their needs, including setting limits on their behavior, including a safe environment for them, not going along with the delusions. Remember early in the slides, you've got to present reality. You've got to present reality. You need to reorient, stay with them if they're frightened, and set realistic goals. So when you go back to the other slide in terms of the support group, yeah, that's going to happen, but it's not going to happen while they're paranoid and in the middle of active treatment. It's going to happen before discharge. Okay, so here we are. A client who is diagnosed with a mood disorder has been exhibiting agitated behavior with other clients on the, excuse me, I lost my spot here. A client who is diagnosed with mood disorder has been exhibiting agitated behavior with other clients on the psychiatric unit. The nurse should plan which activity for this client. Client is agitated. Activity 1, chess, writing, ping pong, or board games. Okay, and poll. Excellent. 94% of you. The client is agitated behavior with the other clients. The question is with the other clients. They're not just agitated in their room, they're agitated with the other clients. So you don't want them playing chess, ping pong, or board games with other clients because they're already agitated. So the answer is yes. The answer is writing, which 94% of you said. And again, keep in mind safety. Safety for your client, this particular client, and safety for others. Next slide. A client is admitted with depression, says to the nurse, "My life has been such a failure. Nothing I do turns out right." Which response by the nurse would be therapeutic? 1, you are certainly entitled to your own opinion. 2, I know just how you feel. I have those days myself once in a while. 3, I disagree with you. We all have some value and accomplishments in life. 4, you seem very discouraged. Can you think of anything recently that went as you planned? Okay, end poll. Excellent. Perfect. You all had a great mental health teacher because it's great. You seem discouraged. Can you think of anything? Therapeutic communication. Can you think of anything recently that went as you planned? Start to turn the client around. You know, they're discouraged now, but anything that's gone as they have planned. And when a client says something like, "My life has been such a failure, nothing I do turns out right," what are you going to think about? Suicide potential. Next slide. A nurse is a nurse is working with a client who is delusional. The client says to the nurse, "The leaders of a religious cult are being sent to assassinate me." which is the best response by the nurse. I don't believe that what you're telling me is true. There are no religious cults in this area that are going to kill you. What makes you think that cult members are being sent to hurt you? I don't know about a religious cult. Are you afraid that people are trying to hurt you? Hold. Okay. And pull. Okay. So, if you remember back, what you need to do that is therapeutic in therapeutic communication is you need to accept the client's feelings and you need to present reality to them. So, one, nobody put that, but two, there are no religious cults in this area that are going to kill you, is not accepting what the client is feeling. I know you believe that cult members are going to cause you harm, but it's not true. I'm sorry, I'm on the wrong one. Oh, sorry. What makes you think that cult members are being sent to hurt you? It's kind of pressing them, like what you're doing in this question, if you think about it, because 50% of you answered it this way. What makes you think cult members are being sent to hurt you? What you're doing then as the nurse is that you are acknowledging that there could be a cult or there is a cult. Whereas, four, I don't know about a religious cult, but are you afraid that people are trying to hurt you? So what you're doing is you're presenting reality. You don't know about a cult, but you are also acknowledging their feelings by asking them if they are afraid that people are trying to hurt them. Whereas number three, you're acknowledging that there is a cult. What makes you think cult members are being sent to hurt you? So you can kind of see the difference in that. Okay, close poll. And next slide. The nurse is carrying on a conversation with a male client who is actively hallucinating. The client is fearful that the voices will direct him to kill himself or will hurt him directly. Which statement would be most therapeutic at this time? I can hear voices too, but they aren't telling you what they think they are. I know which voices you're hearing and told them not to hurt you. I know you believe they're going to cause you harm, but it's not true. Think back to the last question. I don't hear them, but it must be frightening to hear voices that others can't hear. End poll. Okay, so this is a little bit like the last question in that 10% of you said number three. I know you believe they're going to cause you harm, but it's not true. You are then saying that there are voices. You're acknowledging that there are voices, which there are not. So therefore you present reality. I don't hear them. And then you acknowledge the patient. It must be frightening to hear voices that others can't hear. So you're presenting reality to the patient. I don't hear voices, but you're acknowledging their fear of hearing voices. So for a client with hallucinations, no, as I think I said earlier, safety is the first priority. Make sure the client doesn't have an auditory command that tells them to harm themselves or others. Attempt to engage the client's attention through concrete activity when they're hallucinating. You want to try to bring them down to a point where they can do something concrete so they won't harm themselves or someone else when they are hallucinating. Next slide. The nurse is assigned to a client. The client is pacing, that is psychotic. The client is pacing, agitated, and using aggressive gestures and rapid speech. The nurse determines that which is the priority of care, provide safety for both the client and others, offer the client a less stimulated area to calm down and gain control, assist in caring for the client in a controlled environment, such as a quiet room, provide other clients on the unit with a sense of comfort and safety by isolating the client. End poll. Excellent. Provide safety for both the client and the other clients on the unit. That's important. Few of you put assist in caring for the client in a controlled environment, such as a quiet room. If you have a client that this client is pacing, agitated, and using aggressive gestures, you may care for the client in a quiet room, but that's not what the question's asking you. The question is asking you, what is the priority? So think about your Maslow's hierarchy of needs. Physiological needs first and safety. That's what you want to think about when you're dealing with a really aggressive, agitated client in the mental health arena. Next slide. A nurse is caring for a client who was recently admitted for anorexia nervosa. Upon entering the client's room, the nurse finds the client in the middle of a series of rapid sit-ups. What action would be most appropriate for the nurse to take initially? Interrupt the client and offer to take her for a walk. Allow the client to complete her exercise routine. Interrupt the client and weigh the client immediately. Tell the client that she is not allowed to exercise rigorously. End poll. Okay, so 52% of you thought you should interrupt the client and offer to take her for a walk. 38% of you thought the client should be able to complete her vigorous exercise. So the answer, the correct answer in therapeutic relationship with the client is to interrupt her or him and offer to take them for a walk. They're doing rapid sit-ups. You want them to stop. You don't know how long they're going to continue. So to let them continue and complete their exercise routine, how long could that be? By telling a client they're not allowed to exercise rigorously is not therapeutic. So the answer is for sure to stop the vigorous exercise because it's harmful and you need to protect the client. But you can't just tell them to stop. You need to offer them an alternative, and going for a walk with them is an alternative. When you talk about anorexia nervosa, its often onset is from a stressful event. Intensely, these clients, males and females, they intensely fear being obese. Their body image is distorted. disturbed self-concept, that's very common. They're preoccupied with foods that cause them to gain weight. Now, the eating disorder can be life-threatening, and back to my, Dr. Silvestri-Elmore would tell you that I'm famous for my stories. This was at a local gym, and there was a woman there who, it was crazy how thin she was. And she was crazy thin, and she exercised unbelievable amount. So I had seen her in the gym at one point, and I didn't say anything. I don't know if I should have or not. I was not in a professional capacity. But when I went back to the gym about 4 days later, I was told that she died from a massive heart attack. She, other things to look for: appetite denial. They feel like they have a complete lack of control. The compulsive exercising, which is what this question is about. They are often an overachiever or a perfectionist. In terms of physical alterations, and I talked about this person at the gym, it can include decreased temperature, pulse, blood pressure, weight loss, obviously, GI disturbances, teeth and gum deterioration, esophageal varices, varicose in the esophagus from vomiting. They often will miss menstrual periods, and they definitely have bone degeneration as well. Next slide, please. So this is the continuum of eating regulation or altered eating patterns, and we talk about how we adapt. When mental health, all of us, how do we adapt? Balanced eating patterns, appropriate calorie intake, healthy body weight. We move to occasionally overeating or skipping meals. And then we move over toward the maladaptive, overeating or fasting, binging, severe dieting. And there you have your altered eating patterns. So again, for those of you who are taking notes, compulsive overeating. It's binge-like overeating without purging, lack of control over food consumption, anorexia nervosa. Onset is often associated with a stressful event, as I had said. Death can occur. I gave you an example of that from starvation, cardiomyopathies, which was the case of the person at the gym. The client experiences altered body image. In bulimia nervosa, it's a binge purge syndrome. Sorry, I'm on the East Coast, so it's getting later. So they're eating and they're throwing up, and they're eating and they're throwing up, and not therapeutic. Next slide, please. The nurse is assigned to care for a client who is dependent on drugs. Which question to the client is most appropriate? Whatever made you get started on drugs? How much do you use, and what effect does it have on you? Will you be able to talk about your drug problem without getting upset? Weren't you concerned that someone would find out about your drug use? Oh. End poll. Excellent. Excellent. Yes, number 2. And why? I mean, I know you can't, we're not in a classroom right now, but why? Why do you need to know that? You've just been assigned for a client who's dependent on drugs. Why do you want to ask them that? Because are they high? Are they coming down from the drugs? Are they getting high on the drugs? Are the drugs going to cause them to have some sort of psychotic episode? So you need to know how much they use and what effect does it have on them. Asking them, will you be able to talk about your drug problem without getting upset, is simply no, yes, not therapeutic. But you need to understand, remember, safety. You need to know physiologically, remember Maslow, physiological needs, what effect does it have on them, and safety for them and those around them. Next slide, please. The nurse is interviewing a client in crisis to assess the risk for self-harm. Which finding would indicate that the client is most at risk for suicide? Exhibits impulsive behavior, exhibits disorganized behavior, has a history of suicide attempts, has an immediate plan for a suicide attempt. And poll. Yes, 83% of you got this correct. Has an immediate plan for a suicide attempt. That's why you want to watch patients that are depressed. You want to watch what's going on with them, and you want to what? Remember back, what do you want to do? Do you have a plan to harm yourself? Are you planning on harming yourself? The fact that they had a history of suicide attempts, you have no way of knowing. You have no way of knowing whether they've been treated for that, their life has changed. But somebody that has an immediate plan is the person that you need to worry about. Next slide. The nurse is having a conversation with a depressed client. The client says to the nurse, things would be so much better for everyone if I just weren't around. Which response by the nurse would be most appropriate at this time? You sound very unhappy. Are you thinking of harming yourself? Have you talked to anyone specifically about what is bothering you? Those feelings will go away once your medication really takes effect. I know what you mean. Everyone gets that way when they're depressed. Now, everyone should get this right. End poll. Absolutely. Good. That means even with my Boston accent, you're paying attention. That's good. You sound unhappy. Are you thinking of harming yourself? You've got to ask that question. Next slide. The nurse is caring for a client whose husband died approximately 6 weeks ago. The client says, there's no one left to care about me. Everyone that I have loved is now gone. The nurse would make which response to the client? That doesn't sound like the real you talking. I'm sure you have someone if you think hard enough. It sounds as though you're feeling all alone right now. I don't believe that, and I really don't think you do either. End poll. Excellent. Yes, yes, yes. Therapeutic communication. You've got it. You've got it positively. Give them a reason to keep talking. Next slide. The client has been brought to the emergency room after attempting to commit suicide by hanging. The nurse should take which action first? Examine the neck area and assess the airway. Encourage the client to talk about the experience. Administer an anxiolytic medication as prescribed at once. Obtain a detailed history of events leading to the attempt. Poll. End poll. Yes, Examine the neck area. Remember, Maslow. If you have trouble with questions on the NCLEX, think about your ABCs first: airway, breathing, circulation, airway, neck, and think about Maslow. So while you might encourage the client, you might administer an anti-anxiety medication, you are eventually going to obtain a detailed history of the attempt, but physiologic first, ABCs and physiologic. Examine the neck area and assess the airway. Great. Next slide. Okay, sorry, I'm trying to make sure I stay on time here. Hope I'm not going too fast or too slow. A nurse provides medication instructions to a client who is taking lithium carbonate. The nurse determines that the client needs additional instructions if the client makes which statement? Take the lithium with meals, decrease fluid intake while taking lithium, that lithium blood levels must be monitored very closely, contact the healthcare provider if excessive diarrhea, vomiting, or diaphoresis occurs. And pull. Excellent. Decrease fluid intake while taking lithium. Remember, this is a negative question. It's telling you that this client needs further instruction. Do you want your client to decrease fluid intake while taking lithium or increase it? You want them to increase it. They need further instruction. Lithium is, for those of you taking notes again, lithium can be used for manic depressive disorder, bipolar. It can be a mood stabilizer. And here is something that you get a pharmacology question. It's possible you would get, we know we need to take it with meals. We know that diarrhea, vomiting, or excessive diaphoresis, you need to contact primary health care provider. Lithium blood levels must be monitored very closely. And a pharmacology question may be, what is the therapeutic level for lithium? And it is 0.6 to 1.2 MEQs per L. In acute lithium toxicity, the GI tract is affected. That is why they contact primary health care provider for excessive diarrhea or vomiting. And when the GI tract is affected, it can also lead to neurologic and cardiovascular problems. Next slide, please. I just gave you the answer to this one. A client is taking lithium carbonate. The lithium level is checked as part of the routine follow-up. The level is 3.0 MEQs per L. The nurse knows this level indicates which situation: toxic, normal, slightly above normal, or excessively below normal. Now here comes 100% on this one. And Paul? Great, great. Those of you that were listening, the therapeutic level is 0.6 to 1.2 MEQs per L. This at a level of 3 is a toxic level for lithium. Next slide. Client arrives at the healthcare clinic and tells the nurse that he has been doubling the daily doses of bupropion to aid in getting better faster. The nurse understands that the client is now at risk for what problem? You know that's food spot. Insomnia, weight gain, seizure activity, orthostatic hypotension. And Paul? Okay. 57% of you got this right. The patient doubling their dose of bupropion is at high risk for seizure activity. You need to really take a look at your most common mental health therapeutic drugs. Study them. There's lots and lots of them, but study them in terms of categories and groups, what they're for. Okay, next slide. A hospitalized client is on phenylzine sulfate for the treatment of depression. Phenylzine sulfate is what kind of category of mental health, of medication? A lunchtime tray is delivered to the client. Which food item, if on the client's lunch tray, would the nurse remove? Yogurt, crackers, tossed salad, oatmeal cookies. End poll. Good. 78% of you got it correct. And why? What is this? What is phenylzine sulfate? It is Nardil. It is a monoamine oxidase inhibitor, or an MAOI. You need to avoid any kind of foods with tyramine, and that's going to anything that is a culture. That would be yogurt, certain kinds of wine, certain kinds of cheeses that you need to avoid. You need to look, because this is a very, very common NCLEX question, is what types of foods, what types of nutrition to avoid when a patient is taking MAOI. Next slide. A depressed client who is on tranylcypromine sulfate has been instructed on diet. The nurse feels confident that the client understands the diet when given the choice of which restaurant foods. Oh, I must really be hungry. Excuse me, let me do that again. The nurse feels confident when the client understands the diet when given a choice of restaurant foods if the client selects which foods. Pepperoni pizza, salad and cola, pickled herring, French fries and milk, fried haddock, baked potatoes and cola, roasted chicken, roast potatoes, and beer. And cold. Fried haddock, potatoes, and cola. Now, why not the pickled herring? Why not the roasted chicken and beer? Because this is an MAOI. Again, take a look at those. Carnate, it's an MAOI, and therefore they cannot have, what is beer made with? Yeast, and it's fermented. Pickled herring, same thing, the pickling in the herring. Okay, next slide, please. Disulfiram is prescribed for a client being seen in the psychiatric healthcare clinic. Which data is most important for the nurse to obtain before administering this medication? If there is a history of hyperthyroidism, if there is a history of diabetes insipidus, when the last full meal was consumed, when the last alcoholic drink was consumed. End poll. Fabulous. So obviously you know that disulfiram is antabuse. So yes, it's when the last alcoholic drink was consumed. Next slide. A nurse is collecting data from a client and the spouse reports the client is taking donepezil hydrochloride. Which disorder would the nurse suspect based on the use of this medication? Dementia, seizure disorder, history of schizophrenia, obsessive compulsive disorder. And poll. Pretty split up here. Not quite sure what the donepezil is, right? How about if I was to tell you that it was Aricept? Would that change your answer? Well, it wouldn't change the answer for those of you that answered number 1, because this is Aricept and it is a medication. It's an anticholinesterase medication that is used for dementia, early Alzheimer's type dementia as well. Side effects include, for your notes, nausea, diarrhea, oh my goodness, diarrhea, and it decreases the heart rate. Next slide. The nurse provides instructions to the client regarding the use of fluoxetine hydrochloride. The nurse determines that the patient understands how to take the medication if the client states to take the medication in which way. With my evening meal, at noon with an antacid, in the morning when I first arise, right before bedtime with a snack. And poll. In the morning when I first arise, number 3. Very good. What is fluoxetine hydrochloride? Prozac. That's what it is. It's Prozac. I didn't realize that was in parentheses. And is an SSRI, an antidepressant. It can cause restlessness and agitation. So you want to take it when you first get up in the morning. The client to take it when they first get up in the morning. So the agitation, because of the possible agitation that comes with it. Next slide, please. A client receiving a tricyclic antidepressant arrives at the mental health clinic. Which observation indicates that the client is correctly following the medication plan? Reports not going to work this past week. Arrives at the clinic neat and appropriate in appearance. Complains of not being able to do anything anymore. Reports sleeping 12 hours per night and 3 to 4 hours during the day. And poll. Excellent. Arrives neat and appropriate in appearance to the clinic. Great. Next slide. A client taking buspirone hydrochloride for 1 month returns to the clinic for a follow-up visit, which would indicate medication effectiveness. No rapid heartbeats or anxiety, no paranoid thought process, no thought broadcasting or delusions, no reports of alcohol withdrawal syndrome. Symptoms. Time for dinner for me. And poll. Okay, so mental health pharmacology, write that down on a sticky note and put it on your computer or your book or your nose or your mirror so that you know. You need to know what these medications are for. So this medication, and you will not get trade names, you will get generic names, which are hard enough to pronounce, never mind memorizing them all. So the answer to this question is no rapid heartbeats or anxiety. And that is because it's Buspar, and Buspar is an anti-anxiety medication. So no rapid heartbeats or anxiety. If you knew what the med is, you would immediately know that, which a third of you did. So next slide, please. Sorry, I'm I'm rushing a little bit more. Got a few more minutes. A client in the mental health unit is receiving. Did I get cut off on? Wait,
No,
Devin?
that's me. Sorry.
No problem. I thought maybe you cut me right off at 6:20. Sorry, my time. A client in the mental health unit is receiving haloperidol. The nurse would check which item to determine medication effectiveness: the client's vital signs, the client's nutritional intake, the physical safety of other clients, the client's orientation and delusional status. End poll. Excellent. Absolutely. So you all know what Haldol's for. That's good. So don't put a sticky on your mirror for Haldol because you know it. Okay, next slide. Immediately after taking a routine evening dose of alprazolam, the client says, "I'm not sure I should have taken that stuff." The nurse should make which appropriate statement to the client? Anxiety is expected with any new experience. Let's talk about how you feel about taking this medication. You are afraid of the media claims about this medication. Your depression will fade once the medication begins to work. Now, this ought to be 100% too, because we talked about this. End poll. Excellent. And what are you doing here? Say it all to yourself. You are employing therapeutic communication. Next slide. I think it's the last slide, could be. A client is being treated for depression with amitriptyline hydrochloride during the initial phases of treatment, which is the most important. I do? Okay. What is the most important nursing intervention? Get the client tyramine-free diet. Check the client for anticholinergic effects. Get baseline postural blood pressures on the client before administering each dose. Recognize the need for frequent blood levels because of the narrow range between therapeutic and toxic levels. Oh, you're missing. End poll. Okay, so once again, take out your little sticky and add this to it in terms of what you need to do. In this case, it is amitriptyline hydrochloride. You need to get baseline postural blood pressures on the client before administering each dose. Now, why would that be? Because it affects the blood pressure. Okay, you say I'm not done. So what do we have? Next slide. That was my last one. The nurse is performing a teaching session with a client discharged 1 month ago taking fluoxetine. What information would be important for the nurse to gather regarding the effects of this medication? Okay, end poll. I have, oh, no poll here? Did I miss the poll? I'm sorry. Oh, okay, there you go. The answer is number 2, gastrointestinal dysfunctions. So again, hang this up and hang this question up and understand that what fluoxetine is for. Okay? You want me to end here, Angie, 6:24?
Okay, it's me, Dr. Gray. Thank you. This is Linda.
Oh, hi, Dr.
Hi.
Silvestri. What an honor. I just
Oh.
thought it was getting late. We might want to move to questions.
No, actually, we have just about 10 minutes left. Well, about 6 minutes left, I guess. And so thank you so much for that presentation. That was fantastic. And so I want to open it up to the students and see if they have any questions for you or any questions.
I also, Linda, I also looked in
general.
chat. I looked in chat too, and I did not see any questions.
Okay, so anyone have any questions for Dr. Gray or any questions for me about the NCLEX or anything at all? You can just unmute and talk, or you can just write something in the chat. Anything else we want to tell them, Eileen, Dr. Gray?
I don't think so, Linda. I think they've done very, very well with mental health. I think the biggest issue, as they probably all know themselves, is the pharmacology, which, as we know with the generic names, I mean, you saw me stumble over a few of them, that the generic names that can be very difficult to memorize them. And I think you would agree, if you were there for the whole thing, you would agree that it was the pharmacology is where they have the most issues in mental health. And as far as therapeutic communication and all of that, they did wonderful.
Yeah, they did. You did fantastic today. You've made it through day 1. And so 2 more days. You've been a fabulous audience, and we really do appreciate that. And Linda, as Angela mentioned,
there is a question. I don't know if you want to take it. Explain the last question, why the answer was GI.
Okay, go ahead.
No, I said, why don't you take it?
Because I'm not mental health, that's why.
Because that's where the most, go ahead, that's where the most disturbances are. And that's one of the reasons why you want to make sure that you have something to eat when you take these medications, because they can be very upsetting to the GI system.
Yeah, can Devin pull up that question again? Are you able to? We can go through that a little bit better.
I don't have it because I didn't have it in my slides.
Okay, Devin's going to take care of that. This one here,
yeah,
is the one that the student is talking about. Okay, so the nurse performing the follow-up teaching, and what information would be important for the nurse to gather regarding adverse effects of the medication. Right. Okay, so for this question, and the answer is 2, correct, Dr. Gray?
Correct.
Okay, and this, this is one of those questions where you really have to have the knowledge about it and in order to answer it correctly. And I don't know what the polling was, but I would guess that a lot of students selected 1, thinking ABCs and cardiovascular symptoms.
Yeah, or 3, I think, that right there.
Or 3. Yeah, because mouth dryness is really very common with many of these meds, and excessive sweating. But I think one of the key points with a question like this is look at, because see, I said I'm not mental health. I can teach mental health, and I've done mental health, but I'm not the expert in that. But if I look at this question, not knowing that much about this drug, and I had to make an educated guess, I would read the question a couple of times, and I see the word adverse. Okay, so adverse makes me think a little more important than mouth dryness or sweating. And so that would get me to cardiovascular and GI. And then I would really have to use my knowledge base to come up with the correct answer. And if you knew a little bit about this drug, you would know probably that, as Dr. Gray said, many of these meds will cause GI effects. And so that's why you would probably go with 2 over 1. And again, it's back to that knowledge. That would be probably the way I would talk through this question if I had to look at this question and answer it. This drug is probably likely, I'd have to look at my comp review book, but Angela mentioned the last page of the book with all of the list of medications there.
Oh,
And
yeah.
if this drug is there on that list of the top 100 drugs in the US, then you definitely, as Dr. Gray said, make a little sticky note on it and just kind of hook up this drug with GI dysfunction as an adverse effect of it. And that's probably why I would delete 3 and 4, eliminate 3 and 4 is because of the word adverse. And that would at least get me down to the 2 and work there using your knowledge of the drug. So make a little sticky note on that. So it's just one of those drugs that you kind of have to know about to answer it correctly. And I don't know if that helped you or not, but hopefully it did. And the way of talking through it. Okay. Any other meds in the chat or any of the other questions that you weren't sure about and wanted to talk through with us? So as to how maybe we would answer it.
I guess I kind of have a question or comment. So I was going between. Sorry, can you hear me?
I can hear you now. Yes.
Okay.
Yep.
My mic cut out. Yeah, I was going back and forth between 1 and 2.
Yeah.
Just because it did say adverse.
Good.
I just picked 1 because I wasn't sure if the gastro would be just a side effect, not for adverse. So are you saying this drug, like there isn't any associated like cardiovascular like side effects that are known with that drug? Or
Not
what dysfunctions are you talking about when it comes to gastrointestinal?
so now when you talk about gastrointestinal, many drugs, and commonly this drug can cause gastrointestinal, as many do, upset, nausea. But when you look at the word dysfunction, that is what really tells you. So even if when Dr. Silvestri was talking about cardiovascular and GI and getting it down to the 2, I'm looking at the 2 and I'm thinking, okay, cardiovascular symptoms, rapid heartbeat, slow heartbeat, change in blood pressure symptom. But when I see the word dysfunction, that is something that really struck me. And I think of dysfunction in terms of things like, I don't know, ulcer type, serious GI issues. I don't know if you have it right there, Linda. I don't. I'm looking through my other notes here, obviously, in terms of, really GI adverse effects. So hang on.
Can anybody hear me?
Yes, we can hear you.
Yes.
Hi.
Hi.
I'm on my way to campus right now. So I thought if you could hear me, I would jump in. Eileen, I have some notes on this that I can send out to the group on this question and on this medication that I think is going to address their question. So I'm happy to send that out tonight. And also we could maybe address it tomorrow too. Because without looking, I don't know, like I can't even look at the question, but
I know that
it seems like a hard question.
I know it, right. And when I said ulcer a few minutes ago, when I think of dysfunction, I think of ulcer. So you think of something like GI bleeding, which is definitely on the
right.
Prozac list.
Yeah.
So
and
again,
you
thinking of the
know, in
words, mouth,
terms
go ahead.
of GI, you know, that where they have an inflammatory problem with the GI tract
Right,
as an adverse effect of a medication, and that is something certainly that can happen, and then you end up, you know, certain manifestations, diarrhea, dehydration, things like that. So I, without actually looking at the question, just listening to the discussion, I think that's what it is. But I do want to just verify, right? Because we all, none of us can know everything about every medication. So I want to get back to them on it, which I do have the notes. So I just wanted to mention that.
right, right.
I think that
That's
would be
great.
great if you could send them some additional information on that specific drug. Because we see that drug out there being used, so it would be good for them to have, you know, the backup of the rationale. So that would be great, Angela.
Yeah, I'm sure that it's,
I'll do
you
that.
know, I'm sure it's GI bleeding, but relatively sure. But again, pediatric urology guys, as I said, so not, don't have every drug in the brain.
Yeah, and GI dysfunction too can, and I guess the real specifics about GI dysfunction would be great for them to know. But that, as you mentioned too, can be, you know, abdominal discomfort, abdominal bloating,
Mhm.
which happens with a lot of these drugs, and then the diarrhea or the alternate diarrhea constipation, and that can lead to a lot of other problems for these people that have to take this drug.
Any other questions, folks?
That was a great question, Nick, and thanks for bringing that up.
You're welcome.
Okay, so there's something else here in chat? Oh, thank
No, I
you.
think that's Nick saying thank you.
Oh, you're welcome. Okay. Well, if there are no other questions, yeah, I'm not sure about any login issues tomorrow morning. We'll be all set, Devin?
I think I fixed it. I think operative
Okay.
word being there, but in case you need it, it's there. I can provide it to anyone who asks, but you know,
Okay.
fingers crossed, everything works tomorrow morning. Let me know if not.
Oh, yeah, you'll be hearing from us. That's for sure. Okay.
Certainly.
Thank you for all your help today.
Yes, thank you very much. And thank you everyone for the opportunity. I appreciate it.
Okay.
Thank you,
thanks, everyone.
everybody. Thank you
Have a
so much.
great
We'll see you
evening.
tomorrow. See you tomorrow at 8 a.m. Thanks,
Okay.
Dr. Gray, Dr. Silvestri. Have a great evening.
You too. Bye-bye.
Thank you.
All right, I'm gonna close it out now. I'll see you tomorrow, Dr. Silvestri.
Okay, bye-bye. Thank you.